So are there any like typical manual therapy things that you find yourself doing more often?
Yes, this population loves dry needling.
Okay.
Yes.
Yeah.
I probably needle 80% of my patients every day. Yeah. And it's one of the only things where we can get like into the muscle belly.
Yes.
Right? Like if I'm doing soft tissue stuff, I can probably get the same release. It'll take me like 15 to 20 minutes to dig into this muscle, whereas if I can just poke it with the needle and it'll release, we're like, great, get on out of here, we're good.
Love it.
But then a lot of times, like on the back is probably where I mostly do cupping,
okay,
right? Because that's probably where we'll get most of the reaction from it. I've done it when people like don't want to do or have done a lot of needles lately. I've done that like on a quad or on a hamstring type deal. Scraping is probably one of my least used ones. I use that on tendons, right? So more so like an Achilles tendon, a quad tendon, a patellar tendon, hamstring tendons, where I just can't like, needling itself can be used in tendons, but it doesn't get that big jump release as it would in a muscle belly, right? So if a patient's just feeling a lot of that tightness in the tendon, I'll go for scraping. Other than that, I mostly just use my hands and do some deep tissue work, try to do some like trigger point release type stuff. It's a love-hate relationship, but it's very helpful.